So this is our State House here in Rhode Island. I took this picture, so I don't have to give any credit to anybody else. That was one night after a Senate hearing, no, a House of Representatives hearing. So my first question is, what are the social determinants of health? Does anybody, it's like a quiz from last session. Does anybody want to try to answer that? Or you can type it into the chat.
Yeah, I think probably the chat's the best way.
Yep.
What did people get from the last session in terms of the social determinants of health?
Community, right? Yep. Community engagement and social support. Yes. Exercise. Medical health access. Yes. Yep. Michelle's got a lot of them coming.
Yes, Michelle's on a roll.
Nutrition. Okay. So community is one of the social determinants of health, and access to health and medical services is one. Education is one. Yep. Healthcare access is one. Nutrition and exercise are important for health, but they're not the social determinants of health. Right to information. Kind of. Yep. It's important to get that information. It's definitely something that we need. And that's part of the community and the access and the education. I will go legal. No, you're right. Okay. I'm going to click and show us because we got some of them. Education, we got that one. Healthcare access and quality. Social and community context with that social support. Economic stability. And neighborhood and built environment. So transportation is definitely part of this, like access, right? So access and part of the built environment. So these are the social determinants of health. Sherry talked a lot about health equity and needing it to be a multi-sector approach. So the World Health Organization has stated that health equity needs to be a multi-sector approach. So here in Rhode Island, we have health equity zones, HEZ. Put in the chat a yes, a Y, or an N if you know what a health equity zone is. No.
N.
All right, cool. I got an idea. Okay, so we're just gonna watch 35 seconds of this. I let you know it's only 35 seconds. Can you hear it?
No.
Yeah.
Yes. Yes.
Yeah.
Yes,
Okay.
yes.
Okay.
Equity zones are community-led collaboratives that are in a very specific geographic area, making decisions about what health is, what health means to them, what's important to them, and how they want to address the issues that are important to them. And they go way beyond just health, traditional health issues, because folks are talking about the importance of jobs, the importance of education, the importance of housing, all of those factors that at the end of the day are what determines our health.
3 people said yes, Bon.
Oh, cool. All right. So this is review for you. So a health equity zone is multi-sector collaboration. It is resident led. So it's for a specific geographic area with multiple sectors, different types of agencies coming together. And it's to resident led, and it addresses the social determinants of health. Those social determinant of health that I work in, and I am a representative of my agency on a couple different health equity zones, is education. So I just wanted to click this link and show you the HES that I work in. Come on, internet. So this is our health equity zone here in Central Providence. This is the one that this project is for. So Central Providence. And I want to show you the partners. So there are 70 different partners in this specific geographic area, all kinds of partners, clinical partners, community builders, funders, health and wellness, housing, nonprofit, place-based, public sector, statewide workforce development. And then in education alone, 29 different education providers here in the area. So some of them are early learning centers, early learning development centers. special needs education centers, and then adult education, like the Providence Public Library, RIDE, the Department of Ed, Dorcas International, and my agency is on here somewhere. Genesis Center. We should be here. I'm not seeing us, but we're there. Trust me. So these are all agencies that come together to work with residents in a community to figure out where are the areas of social determinants of health where we can improve, and what do the communities want. So let me go back to, yeah, there we go. So that's a health equity zone. We all get together and we work with people in the community and listen to their voices and their stories and do a data dive into that specific zip code to figure out how to improve health equity. So my part of this health equity zone is in partnership with Federal Hill House, which is a early learning center. And we have created something called the Family Learning Academy, which is adult education, case management, family coaches who run workshops on childhood development and strengthening childhood development and looking at the early learning development standards that we have in Rhode Island. And then PACT time. Do you know what PACT time is? Another lots of questions for you to chat. Yes or no?
No.
Okay.
I'm putting in yes for me. No.
Okay, so some people will learn something right here. So PACT time is parent and child together time. So part of this program is having adult education courses, supports for the children, case management for families, family coaches, child development workshops, and then activities where the parents and children get together to do activities together that help strengthen learning for both generations. So it's an intergenerational activity. As far as my house goes, I'm going to start talking about the composition of the class. So my class of the Family Learning Academy, I taught the ABE cohort, the 5th cohort of this project. And so all of the students in my class lived in the HES area of 02908 or 02909. So those are the specific zip codes where this work was being addressed. All of my students were mothers. Our mothers, we're still having class right now. They're all high school equivalency graduates, and they're all scoring 230 or above on the CASAS, which is fairly high. Does everybody here know what CASAS is? Yes or no? Is it something you use in New Jersey? Yeah. Okay, cool.
No, not a yes.
Yeah, cool. And then they're all TANF eligible. What does TANF stand for? This is another question for the chat. What does TANF stand for?
Temporary assistance for needy families.
You got it. You got it. Temporary assistance for needy families. So all of these students are TANF eligible. Here's a picture of me with one of my students at the House of Representatives. This is the Finance Committee hearing room. So we were there one night for a number of hours, sitting and waiting and listening to all the testimony for child care funding to be increased here in Rhode Island. So let's see, I missed something. I'll talk about it. Okay. So what did we learn in this cohort? So I want to talk about data language and the language of rhetoric. All of my students are English speakers, native English speakers. So the basic vocabulary was there, and we sort of dug into different types of vocabulary. So first we started with how to read graphs and how to, I threw myself off, but we began the class with a lot about, like, the first couple weeks was spent on looking at their own community and their own neighborhoods and looking at data that they could collect, like simple stuff like how far away is your nearest playground? How many trees can you see from your window? So really looking at sort of like the physical environment, the built environment of their neighborhoods, and getting them to sort of collect data and just counting things like how many grocery stores are accessible by you? Where can you get fresh fruits and vegetables? So we did a lot of that stuff just to set up set the stage and get to know where we were, like who's in your support circles, like who do you call? And then we practice making visuals of that kind of stuff. We also learned how to read different graphs, how to choose the right graph for the right data. So we basically focused on pie, bar, and line graphs. Which one of these would be best for showing change over time? You can type it in the chat. Pie, bar, or line? Line, yes. And so we talked about how, line is best for showing change over time, and pie is best for showing a whole, and just when are you going to use which one? And we talked about qualitative versus quantitative. We learned those as vocabulary terms. We talked about we learned what key findings means and what a respondent is. And then we focus more on rhetorical strategies. So ethos, pathos, and epistrophe. What is pathos? Somebody put it in the chat. That's a little bit of a harder one. Appeal to emotion. Yes, excellent. So we really talked about how we looked at a lot of data and we watched a lot of testimony and a lot of legislative testimony, and we sort of picked out what was the pathos and what was the ethos, and one of the people in our state who runs the Rhode Island Kids Count organization, Paige Clashes Parks, is really good at epistrophe, and we watched one of her speeches. So that was fun. And then we did a lot of self-determination and owning of our own stories. So the idea of the quantitative data next to qualitative data, along with our story and how to tell our story using rhetorical strategies to effect the change that we wanted to see in our community. Let's see. So these are different resources that we used. So we started with reading and interpreting data, UnitedStatesZipCodes.org. We just used our 2 zip codes. And that website has a lot of different charts about how many people own homes, what's the median cost of a home, what are the age ranges of the residents of that neighborhood. We looked at the Rhode Island Health Equity data on our Department of Health website. Rhode Island Kids Count issue brief on racial and ethnic disparities in the K through 16 education in Rhode Island. So these were all places where we looked at data and we interpreted it. We also worked on how to write for change, and we read a lot of articles from the Change Agent, which is an excellent resource, because these articles are written mostly by, contemporaries of my students. So it's writing that they could be doing. And then we watched Rhetoric in Action, the Raising Rhode Island Coalition Legislative Kickoff. That's where we saw Paige speak, and Rhode Island House Finance Subcommittee on Education, the testimony for adult education funding, because, we're always trying to get funding. We don't have enough of it. We need more of it. And we also did some work on how to create data right at the beginning, where we were talking about our support systems and how many trees can you see from your house. And we surveyed the students halfway through the semester. After we had talked about all these different things, I asked them, what do they want to focus on moving into the second half? So the class was really student-led, because the HES work is resident-led. So I wanted the class to be student-led. And then we focused really on what they wanted to do. And we also did some informative reading. Like we read some informative writing and then worked on visualizing data. So over under how to read and interpret data, we had the visuals and we had to interpret it. And then here we had the facts written in a narrative form and we had to make visuals of it. So we're practicing on both sides of that. Is there anything in here that you would like me to click on? Because I don't know if we have time for me to click on all the things. So I thought we would just ask in the chat if there's any of these that seem really students.
So while people are thinking, I'll make another sales pitch for the Change Agent. Cynthia Peters, who's the editor of the change agent. She came and she was the plenary speaker at a NGL conference about 3-4 years ago. So we have some history with the change agent in New Jersey. I think a couple of years ago, there was a program that had a couple of students who had pieces published in the change agent. So every year they send, or a couple times every year, they send out calls for pieces. So I encourage you to keep your eyes open for that and to have students submit work. The nice thing about the change agent is I've been on the guest editorial board. Most of the time, the guest editorial board is at least half students, right? So not only are the pieces written by students, but they're evaluated and selected by students as well. It's looking like the student survey results and how to create. So maybe that, yeah.
Okay. So this was an interesting one. These are all our questions across the top, to pick no more than 2 areas of interest you'd like to continue focusing on, skills you would like to further develop. Why did you make the choices you made? And if anything, what makes you nervous about advocacy? And is there an issue left out that you really want to focus on? Please tell me and we can work on it. We can work it in, because I want to make sure that, an important part of communicative justice in data literacy, in my opinion, is what's, who's not being included, like what is not being asked, right? So what is not being asked? If I'm the surveyor, like, what is it that I'm not giving space for the students to say back, for the respondents to let me know. And so this is all the data collected from the students. And then down here, we worked as a group on what our key findings were. So we looked at how many people answered, everyone said public speaking under skills, right? What's under skills? Or was it over public speaking, talking in front of others, speaking in front of a crowd, not being heard, talking in front of a lot of people. So one of our key findings was that everyone needs help with public speaking. And we talked about most versus a few versus more than half as far as language used to talk about data. So most respondents want to focus on adult ed funding, because that was 80%. And we did this as a group in the class. After everyone finished the survey, we looked at the survey together and we said, this is your data. And what does it say? What is it saying? A few respondents were interested in the Raising Rhode Island Coalition work. More than half wanted to work on writing skills. And most respondents want to focus on affordable housing and Black home ownership. And then we practiced turning them into actual charts. And this was fun because one of the takeaways from this here was these are the things that we wanted to focus on. And on a bar graph, because when you're showing like different whole chunks like this, we talked about how this wouldn't work as a pie chart, but it does work as a bar graph. And when you make this as a bar graph from 0% to 100%, there's not a ton of difference in which ones are more important than any other ones, like who wants to focus on what. But when we visualize the data to start down closer to the lowest one, which is 40. So if we start the graph at 35 and we end the graph at 85, the data, the visualization of the data can tell a different story. And this was kind of like an aha moment, because just because a picture looks a kind of way doesn't mean that it's like telling the whole truth, right? And that we can use these things to sort of make issues look bigger than they are or smaller than they are. And that was really kind of like cool for us to look at our very own data and how we can visually represent it. So that was a really cool learning from this activity.
Bonnie, can I interject something real quick about that?
Yeah.
So I have some really good examples of bar graphs that lie, where people will put the percentages in, but change the size of the bar. So I have one from an election, I think it was in Honduras, and the guy that won by a lot, but they made his bar graph smaller than the person that lost. So if you looked closely, you could see the percentages, but just looking at the bar graph, one looked bigger than the other. So you'd be like, oh, she won. Oh, no, she didn't. Right. And so we have to do close readings of bar graphs in the same way that we do close readings of pie charts and other things, because people might want to, be doing funky stuff with the information that they're putting out there.
Yeah, exactly. So that was like a really cool thing for us to notice together and like sort of talk about. So let's see the next slide. And this is work generated. I am really flying through this. So I guess we could look at some more stuff or stop for questions. Is there anything else that anyone is interested in looking at on this slide? As far as resources that we used? I can say another for the change agent, this class started right when the last call for submissions came out for the change agent, which was like perfect timing. So we really read a lot of the change agent and we practiced our writing around the latest, the most recent call for submissions. And one of my students actually submitted something for this round. So we'll see.
Bonnie, maybe can you open up and talk a little bit about the zip codes?
Yeah.
Because that's accessible data that can be used in a couple of different ways.
Yeah, this one was neat because there's so much here, right? So I'll put in one of our zip codes. And so we're able to look at our like a map, right? So this is one piece of data and the coordinates and then like stats and demographics. So we have like estimated population over time. So we can look at how line graphs are good to show change over time. Total population by age. And so we looked at this like, and we're like, what is the age of most people that live in this area? Right. And we were able to say most people are between 15 and 19. Right. And then we have gender and race, head of household by age. And we sort of went through all of them and sort of talked about specific ones that were interesting to them. So here's like, this was an interesting one because we talked about how it says husband, wife, family households. And then there's single guardian households, but there's no two-parent households. So if you're asking the question on the survey about what kind of household, and you're asking if it's husband, wife, and you're not asking about two-parent households, then you're leaving out like a significant portion of LGBTQ families who aren't husband, wife households, but are also not single guardians.
Or
So-
also, Bond, excuse me for the question, people in extended families in other cultures, like I live with my aunt or whomever, those guys get left out as well, no?
Yeah, I mean, with these are the only categories. So we talked a little bit on this one about like, if you only have a few categories, like people that don't fit those categories aren't going to fit into the data. And that goes back to the idea of communicative justice and representation. Like if the language isn't there and the option for who I am doesn't exist in the data, then I'm not representing the data and I don't have any way to put voice into the data. And so we talked about that a little bit here because it's sort of an example of communicative injustice. Eric,
Right.
you unmuted.
Yeah, and that data is constructed, right? So data is created through a process of analysis. And so therefore the data that they're creating here, right, is a result of choices they made, right? And so we can't just take it as a given, right? We have to think about how was this data generated, and it was generated from a heteronormative perspective. So it, and a nuclear family perspective. So it doesn't have these, multiple options there. And so when you look at it, you have the numbers, but then you also have to ask questions about how the categories were decided upon, and what those categories suggest about people's worldviews.
Exactly. And so we had an interesting conversation about that on this one. And then, kids by age, like how many kids live in this neighborhood. One of my students who lives in this neighborhood has a 4-year-old and an 8-year-old. So there's this many 4-year-olds 453 4-year-olds in the neighborhood and 391 8-year-olds. So it's like specific raw data, the number, right? You can look at the comparative, like, oh, the largest amount of children are, or the largest amount of children are 20, which I guess that's children, not really, but the idea that there's raw data here also, right? Like 414 3-year-olds are in this neighborhood, so they could all end up at the park at the same time. These are my community members. And then housing was an interesting topic, because one of the questions I asked when we were doing this, so like what I asked my students was, what do you notice, right? So we were looking at different ones and we just said, what do you notice? Not what does it mean? Like the first question is just, what do you notice? And then the second question was, what questions do you have about this, right? And so on housing, they noticed that the largest bar was houses built in 1939 or earlier, right, in this neighborhood. And then we continued the conversation about how nothing has been built in this neighborhood since 2010. And this is a social determinant of health, like the building, like the built structures in the neighborhood. Like most of the houses are before 1940. We didn't stop using lead paint until the 70s, right? Like what is happening in this neighborhood? So these are the things that they're now more aware of, right? And we are actually we did look at some housing legislation that's very important to them. And most of the class is attending the Home Housing Network of Rhode Island annual awards dinner cocktail hour next Monday night. So I'm trying to get them into not next Monday, then Monday after that. I'm trying to get them into situations where they can network with people that are in power and get to know people and hear about this stuff. So hopefully they'll be more comfortable and they can do more than, I don't want to say just writing testimony, because that was like a huge thing that we did, but how to keep moving forward with it. So these were interesting. And then how many people own their houses, right? How many people owned their households in the area, and how many were renter occupied. And most of this neighborhood is renter occupied. So.
Well, and then here, Bonnie, as well, like the percentage that where you have vacant households, right? So, at the same time, there's sure to be unhoused folks in that zip code, right? Which is a completely health determinant, right? Whether you're sheltered or not, right? You have vacant places.
Yeah. So this is like this, we could look at this we did look at this multiple times, right? And we also use the 02908. So this resource is like so valuable. What's a zip code where you are, Eric?
Mine's Montclair, so I'm not going to give you Montclair. Somebody in Newark or Irvington or
Type
East
it right in
Orange,
the
put it in the chat, yeah. Or Perth Amboy, 07102. Renee, what is that? 07102. Newark. Okay, great.
Newark, right? So you have this area of Newark, and this is more relevant for everybody in this training. And you can see like the estimated population over time. Holy wow, right? Like the population really grew from 2005 up to 2019. Total population by age, most people are between 20 and 24. Gender, race, majority of folks in this area are Black or African American. Head of household, families versus singles, right? So a lot of singles here. But again, we don't know about other types of family households in this neighborhood because it's left out. This is interesting. This looks different than ours. So this would be a good one to ask the class. What do you notice, right? Oh, I noticed like these are all very low, and then this one is very high. So there's not very many young kids in this neighborhood. Housing type, in occupied housing units, correctional facility for adults. We don't, on our 02907, we don't have correctional facilities in that area. college student housing, and other non-institutional. How many years the housing was built? You can ask, what do you notice about this? Looks like there's been, housing being built throughout the years, but again, most before 1940 and not very much after 2010. Right. And then most is renter occupied, even like a lot. Oh no, that's renter occupied and this is household vacant. So there's a lot that you can look at here too. Owner occupied homes. Oh, this was interesting because these are salaries. I can't remember what we were talking about here, but it was like we had a really interesting conversation about who owned a home and how much money they were making. So,
This looks like it's the value of the home.
the value of the home.
Yeah.
Okay. It does say somewhere. All right. Cost of monthly rent, including utilities. So like cost of a 2-bedroom, 487 units that are 2-bedroom cost more than 1,000. So there's a 24 2-bedroom units that cost 200 to 299. And when we looked at this for our area, we were like, what? How does it cost 200 to 299 and have 2 bedrooms? Like, what do those units look like? So we had a conversation about that for our area because we had the same thing. Like some of these are kind of like, how is it that cost for a 2-bedroom when most of them cost over 1,000? Right. And we sort of contemplated on what that could mean. So let me take us forward because I want to show you some of the work we did. I do have other clothes. As you'll notice in this picture, I'm wearing the same thing because this was an event this morning. Like I went to an event with these folks. This is myself, a case manager, one of our students, and Senator Sandra Cano from one of our districts here in Rhode Island. We were all at an event this morning for a nonprofit organization that specializes in assisting victims and survivors of domestic abuse, sexual abuse, and human trafficking. So we went to this event this morning because it was important to us, and we wanted to see their speakers talk about the work that they do. So it was an opportunity for us to network, and I introduced them to one of our senators. So this is kind of like the advocacy work that we're doing. These are examples. Because I'm opening it in my different account. Okay, hold on. So we have testimony to ban rental application fees here in Rhode Island, testimony to support Rhode Island Works, which is what we call our TANF program. So Temperance wrote that testimony. Misha wrote testimony to support TANF. Maria wrote testimony to support pregnancy benefits. Temperance wrote up some key findings from the Rhode Island Kids Count brief. Let me see. Let me sign in with my other account. Oh, it's not going to work on this one. And we have a change agent submission and visualization of data from the informative text for the Rhode Island Workforce Alliance fact sheet. I'm just going to open up my other browser so I can open some of these. Let's see.
So while Bonnie's doing that, one of the things that we talked about in the study circle was how to communicate these ideas, right? And creating visuals that really sold the story and sold the point, right? And so this is something, again, that the learners can take the lead in, and then think about how graphic design and rhetoric are connected, right? So how do you most effectively communicate your point of view and advocate using the data that you have? Not all graphics are created equal, right? So, some of them are definitely more powerful than others.
So a couple of testimonies, and I want to pull up some of the visualization stuff. So sorry. Looking for the correct. Here we go. Key findings. Thank you so much for your patience.
Well, it's teachers, so they have to have wait time built into them, right, when they're in their classrooms.
Right. All right. One more. Okay. So what do you see on your screen?
The two House Finance Committee from Maria in support of H5644.
Yes. So this was, we had templates that we could work with. So we had templates in Google Classroom. So I did this. This is all an online class. So I did it all in Google Classroom and I put in the template and then they would get a copy that they could then edit. So this stuff at the top, May 2 House Finance Committee, RE in support of 5664 and the name of the chairman and the members of the committee. That was all there. And then they had to put in the rest. So, oh, I meant to.
Nobody saw that.
Nobody saw that.
Nobody saw that.
Okay. And she talked about in here, as a parent and a resident, I urge you to vote in support of this so that soon to become mothers have help, not only with their baby, but while pregnant. And she talks about her story. So this is where we really like, what is your story? When we looked at the legislation, like what can you bring to this as testimony that can help, help convince these legislators to vote to support first-time pregnant people who are living in poverty. And she told her story about her first pregnancy being very complicated, and she had to stay in the hospital for 5 weeks before her child was born. And this was her story, and she, please vote in support of H5644 so that in the future, moms in my position can get help when they need it and not have to wait. And that was like a big deal for her to write that. And she came and she sat next to me and she was actually going to speak, but that testimony lasted all night and she had to leave at 8 o'clock and go take care of her kids. So I didn't end up speaking that night until almost 9. She was the one in the picture. More testimony. Support.
Can I just quickly interject? I really appreciate you doing this. I was recently asked to write a piece about adult ed for something in Rhode Island. And I was asked, can you get a quote or success story? And I was really not wanting to do that because I think there's a tendency to sort of flog our students for the greater good. So what I really, really appreciate about the way you've done this work is giving learners the option to understand this is what happens. I'm curious to see what happens when they go to a meet and greet, how that, like, what are the social consequences and how people feel about that. But giving people agency and authority to make those, giving them, they have agency, but making that part of the process where it's not just, all right, we're going to the State House, looks sad. So thank you very much for sharing the way that you've done that.
And we talked about that because when we watched some of the kickoff, the legislative kickoff for the Raising Rhode Island Works campaign, when the parent speaker got, because there's like the head of this organization and the head of that organization, the parent speaker got up and she was great and she was moving and she was crying. And we talked about it as a class, like how moving that can be. And also like, how can we better prepare ourselves so we're not, we're not allowing people to exploit us in for the greater good, because like we want to own our own stories. And so this here is like this student owning her story and choosing to share it. I didn't make anyone actually submit anything. And students didn't write all the different, because we had opportunities for lots of different legislation. And so they got to write the ones that they wanted to write. And they didn't have to go and speak in front of the Senate or the House of Representatives or any committees. they got to choose that. And we talked about the difference, like between like owning your story and having someone else take your story and use it the way they want to use it.
And Bonnie,
And-
as part of that, I mean, I think we rely upon students to tell, as Janet was saying, to tell their stories a lot, right? But the process of kind of developing their data literacy skills and potentially including that data in their stories expands their skills beyond that one moment of advocacy, right? So that it gives them a facility with numbers and a facility with data that they can use in other aspects of their life as well.
Exactly. Some more, again, sorry, thought I got them all. Some more testimony about the Rhode Island Works and her story being a single mother of two. As a parent and an advocate, I urge you to vote and support. This would make a significant impact on the lives of many struggling families in Rhode Island. Those are different writings that they did. Here's key findings from one of the briefs on racial and ethnic disparities in education here in Rhode Island. So reading through the brief, this student then took out like 5 things that she noticed from the brief, like 5 pieces of data that she was able to take from the brief written by Rhode Island Kids Count. And then she wrote a little paragraph of her own personal response to it. And so she found like white kids were the most enrolled school in October of 2021. So the highest enrollment of different racial and ethnic background was white. Chronic absence rates were mostly for minorities and low income children. Asian kids have the highest percentage of meeting the expectations on the RICUS. Asian and white students have 88% 4-year graduation rate, and the Hispanic children have the highest percentage of students referred to law enforcement. And this is all just data coming out of our state. And so this was her response to it. And she believes that these families had some of the same opportunities as the white families. Things like this could change. So it's like empowering to know something to be true in your heart and in your experience of everyday living, and then to see it in an official brief and like have the ability to read the data and say, yeah, I knew that was true. Like, I'm not surprised by it. And now I can read this and see that it's true. Like, nobody can tell me it's not true. Right. And then another example I want to show you was just taking a piece of data from reading. So this was from the Workforce Alliance fact sheet. And they all had to choose a piece of the data that was written here. Right. Because it's all just a list. There were no pretty pictures in this fact sheet that the Workforce Alliance put together. And we practiced turning a piece of that data into a visualization. So this was part of us practicing creating the visualization for the data that we found.
And just to add also, just as an aside for people that look at that and may be worried, in Excel, it turns things into a pie chart for you. So you don't have to have any fancy coding skills or fancy math skills. Excel is already set up. If you input the data as they did, it'll generate the pie chart for you, which is a really nice feature of Excel.
And Google Sheets. And we learned how to do that. Like, you still have to make sure that you put certain things in column A and certain things in column B, and make sure that you highlight it correctly in order to make it. And it will always just turn it into a pie chart first. But we looked at, you can, it'll default usually give you a pie chart, but you can choose what you think is the best type of chart over on the side. And we talked about, when we were making these, what kind of chart is best for this data? And this is a whole, right? This is the assessment of everyone, and then pieces of a whole. So we use the pie. So we're back to my slideshow. Is there anything else you want to see that I didn't show you? I think I showed you almost all of it. We'll save the change agent submission, because hopefully she'll get published. You can just read it in the next change
that would
agent.
be great.
Yeah.
So I dropped the PD certificate link in for folks. So are there any other general questions or thoughts that folks have about using data. So again, not just information, right? Raw information, but data, stuff that's been analyzed and thought through. And whether it's about housing, whether it's about, age, whether it's about, access to healthcare, the types of data, Bonnie, the types of data that you were showing are things that everybody can work with, right? You don't have to be a statistician. You don't have to be, a political scientist. If you look at the housing stock is all built before 1939, there's some obvious questions that come up, right? Or, if the cost of rent in a certain zip code is going up, like what is that going to do to people's ability to stay in that zip code, right? So there's really easy things that you can do with the data. And then Janet, you had something in the chat that you wanted to call attention to?
Just real briefly, I was reviewing some career thing from New York State about career. I just said that but in the panoply of resources, and maybe some of you have seen it, there's this huge, giant brain, staggeringly enormous collection of data resources at that link. So you could just go down that rabbit hole and we'll come and get you in a year or so. But it's a great resource for visual data and other sorts of data.
Can you see it on the screen?
Yeah, in some of these cases, getting to it can be a bit vexing, right?
Oh yeah, exactly. I'm
But
not.
once you get there, the data is easy enough to work with, right? So
yeah. So you sort of need to set aside half an hour or an hour at a time. It's like in my review, I suggested you might task yourself with, okay, I'm going to look at this much. But they do break it down by levels, by language skills. So it's there.
Very cool.
Other folks, thoughts, questions, suggestions around the idea of data literacy, communicative justice more generally? I will say we didn't really touch upon this in this session or the last one, but one aspect of communicative justice is making this sort of information and data available in languages other than English, and so we're using it in our ESL classes or our ABE classes, but if we're thinking about the health of our communities more broadly, we need to think about our fellow residents who maybe aren't at that stage of their English skills, right? And so for them to fully take advantage of that data and information, it should be available in languages other than English.
I'll speak to that a little bit. Our Family Learning Academy, I was teaching the ABE cohort, and there's 2 ESOL cohorts, like a beginner level and an intermediate level. And the family coaches are bilingual, and some of our senators and House representatives are also multilingual. And a couple of our FLA ESOL students went to the State House for an advocacy event for childcare we have every year called Strolling Thunder, where parents come in with their strollers and their babies, and it's a big speaking event. And then 2 of them stayed and spoke to one of the committees about increasing childcare for all and making it affordable. And they spoke and they testified in Spanish, and they had the family coach actually translated for them. And they were actually, Senator Cano was on that committee, and she responded to them and said thank you to them for coming and speaking in their own language and testifying. So we were doing it in those other classes. I just wasn't teaching those classes. So.
Okay.
Eric and Bonnie, I'm sorry, Eric and Bonnie, first of all, I want to thank you for a great presentation, Bonnie and Eric, for offering this. Bonnie mentioned a lot about advocacy work that her students did and the multi-sector collaboration. And Eric, you just brought out a point about the fact that resources and data needs to be available in different languages. And Bonnie gave a great example of your program where there are opportunities for advocacy in other languages. I think this is one of the issues, not only with health, but with all of the advocacy work that we've been focusing on through this research project. Janet has also been involved with this, is really reaching out to underserved and vulnerable populations. And right now we have a huge influx of immigrants and refugees in the United States, but even without so many people coming in, we need to have more focus on all of this information for other cultures, other languages, and more training for our educators and our administrators about how to reach out to these other cultures and populations.
Yeah, thanks, Sherry, for that point. So just in case maybe not all of you know this, but the chat is full of like some good links. And if you don't know already, you can download and save the chat. I see sometimes people take like screenshots, or they try to like, copy down email addresses and stuff like that, but you can actually download the chat as a file, and then you'll get all the information in the chat. And there's a couple different ways, depending upon what system you're using. Sometimes in the chat area itself, there's like the 3 dots, and you can click on that and it says save chat, or below it might say, under chat, and you can click on that and save the file on your desktop. So there's a couple of different ways to save the chat in addition to just trying to do screenshots and write things down.
One last thing I'd like to jump in and thank you all for, especially Bonnie, Sherry, Eric, but all of you for your participation, is what I noticed, the US Postal Code's zipcode.org site, using sites that are not only adult ed sites, but are what I like to call civilian sites, or just this whole thing about authentic materials, looking at and also calling out to learners, how do you use data? Is a flyer from the supermarket data? I mean, so at a certain point, everything's data, so nothing is, but really looking at where people already are and the kinds of data, I mean, especially with WhatsApp and Google and things that people use, but I think I've made my point.
Well, Jen, I think that's a good point. So the flyer from a supermarket, that's information, right? It becomes data when we have a question about what's in the supermarket and who has access to what, right? Or if we compare a couple of different flyers, or how much an organic banana costs, versus a non-organic banana, then that can be data, right?
Thank you. Yes, exactly.
Analysis.
Well, thank you. Yeah, thank you, Eric, for extending the opportunity. I really enjoyed talking about this work, and I'm really proud of my students. And I am just honored that all of you decided to spend time together and listen to me this afternoon.